Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. It's a webinar where we're going to discuss Lyme disease. You always throw me some curveballs. I'm interested in what questions you have for me tonight that will do that, but usually I'm able to handle most of the things you send my direction. I look forward to exploring Lyme disease with you through your questions tonight. And as many of you know, no two webinars are the same because it all depends on what the questions are that you ask. Sometimes we get into a theme of the night, unplanned by me. It all occurs with what your questions provide us. For those of you that are new, welcome. And there's a couple ways you can participate. Number one, listen to the questions as I read them. And also, if you're in the live version, you'll actually see them on your screen too. They don't display if you're listening to a recorded version, no. But listen to those questions and see what responses I give. There's usually some good information that you can use to help yourself. Second way is actually write a question to me. The way you do that, there's a chat box on the lower right-hand side of your computer. Write your question to me through there. The only thing I ask is as you write it, do not click the enter key until the whole thing is done. Each time that you click the enter key, it sends a separate question blurb to me. And it gets really hard to follow on my side unless it's all put together, basically. All right. I am creating a recording of tonight's webinar. My anticipation, if everything goes as planned, that's the wild card if it goes as planned. But if it goes as planned, I'll have a synopsis of that webinar created for you and an edited version of the webinar recording out to you by around 9 or 9:30 in the morning. Usually sometime even well before then. Every now and then I do get a hitch and it comes out later in the day. So next week we will be off. But the 3 weeks after that, I'll be back doing webinars with you again. So in the email tomorrow morning, I also have a sign up form so you can sign up for the next series of webinars that begin in October. I can't quite figure out how we got to October, but they begin in October. So without any further ado, let's go ahead and get started here. One last thing. Again, if you're in the live version, you'll be able to see the question on your screen. At least that's the way it's supposed to work. And so that will be helpful for you to follow along with that. And then so usually I'm not able to get through all the questions. Okay, so know that I'm doing my best. And I've got a lot of stuff to discuss with you, but I'll try to get through as many as we can in the hour and a half that we're going to spend together here tonight. Okay, all right. So without any further ado, let's go ahead and get started with the first question. Hi, Alexander. Let's see. My family was exposed to mold in our previous home, and as you recommended, we decided to get it tested via real-time labs. We all came back elevated for trichosethine, gliotoxin, zearalenone. My wife and myself show symptoms. However, my 10-year-old daughter isn't showing any symptoms and is a normal kid. Still, due to her high levels of being elevated, our doctor wants to put her on cholestyramine. Question, do you still treat your mold patients that have elevated mold toxins but show no symptoms? We are on the fence giving her medications that she might not need and then deal with the possible side effects that come with it. Thoughts? Thanks. So, every physician is going to do things differently. Okay, so if I disagree with what your physician is doing, it doesn't mean I think they're wrong. It's just I have a different way that I approach things. So one thing we have to keep in mind about testing is testing, there's always the risk with any test of having false positives, okay? That is where a test says you have something, but in reality you don't, okay? Now, granted that if you and your wife have elevated mold toxins, that means that your daughter probably has the same genetics. She got the genes from you and your wife. And therefore, she probably is a genetic setup to have the problem too. So she probably has the setup for it. And so there probably is a high likelihood that this isn't a false positive. But keep in mind, there's false positives. All right. Now, when we interpret test, we keep in mind there could be false positives. And there's something we call a predictive value. And that is when a test comes back positive, what's the chance it really is positive? Okay. It really is true. And so that predictive value increases with the number of symptoms you have of the illness, all right? So if you don't have any symptoms of the illness, there's a probability it could be a false positive test, okay? The other thing to keep in mind is there are no symptoms of the illness. It may mean that her body is able to deal with it fine. It doesn't mean her body will always be able to deal with it fine, but right now at her age, with her diet, her amount of exercise, her stresses in life, all those things that contribute to health, she's dealing with it fine if she has it, okay? And so I think there's two ways to go. One is to say, given that you and your wife are having problems, she's got your genetics, it is an illness that has a genetic profile that leads to you having problems. There's a probability down the road, if she has the toxins in her, that she may develop problems down the road. Okay. So you could, but you still have to keep in mind there may be a false positive, but I think given the genetic profile of you and your wife having this problem, meaning if you and your wife have it, you both have the genetic setup for it. That means your daughter probably does too. I think there's two options for you to consider. One is head off any future problems. Go ahead and do the binders. Okay, that's option one. Option two is keep an eye on her. And if she enters even a young adulthood, if she gets that far without having any health problems, make sure she's aware of this thing called mold toxin illness. And if you start seeing any signs of her developing symptoms consistent with mold toxin illness, at that time, go ahead and deal with the issue, okay? I think you could go either way. I don't think there's a right or wrong on this, but those are the issues to consider, basically, okay? All right. Good luck. Oh, symptoms of mold toxin illness. So just cover those real quickly. So many of you have heard me talk about cytokines throughout these webinars. Cytokines are chemicals made by white blood cells whenever they see mold toxins, too many yeast in your intestines, Lyme disease and co-infections, small intestine bacteria overgrowth, okay? COVID triggers cytokines too, okay? Now, cytokines are good and bad, all right? On the good side, cytokines cause more white blood cells to be made. They draw the white blood cells to where the problem is, and they help the white blood cells work better, getting rid of mold toxins, for instance, or getting rid of Lyme, or getting rid of COVID, all right? But in certain conditions, the immune system doesn't do a good job, and it keeps trying harder and harder, and eventually it makes too many cytokines. And symptoms of too many cytokines are the same. They're identical to Lyme symptoms. They're identical to mold toxin symptoms. They're identical to yeast symptoms. They're identical to SIBO symptoms. Many of these are because they're excess cytokine symptoms, okay? So if your daughter starts exhibiting excess cytokine symptoms, like having poor thinking, fatigue, poor sleep, body pains, neurologic dysfunction, hormonal dysfunction, if she starts having any problems in those realms, you have to start wondering, is it that her threshold of being able to handle toxins that are in her has been crossed? And now you need to start dealing with it, okay? All right. So that raises another thing I want to talk with you about real quickly. So there is a phenomenon in medicine called the total load phenomenon. And that is that any one of us can deal with a health insult and may not have any problems. But if you put a number of different things together, eventually it adds up to create a health problem, okay? So for instance, there could be people running around out there that have Lyme living in them and are healthy as all get out. And then they go out and they stand in a building full of mold toxins, they breathe those in, and they start living in a building of mold toxins. And eventually the addition of mold toxicity coupled with their Lyme creates enough health problems, okay? So it's what's called the total load phenomenon. There's a variety of things that maybe each individually we can deal with on its own, or a few different things on its own, but you put one more drop in that rain barrel and it overflows, and then you got health problems, okay? All right. Thanks for our question, Alexander, and good luck to you. Good luck to your daughter. Alexander, again, let's see how Dr. Ross. In regards to yeast overgrowth, I see you recommend two options for treatment, one prescription, the other herbal. Which one is better, and how will you know if you have been cured and know if the treatment was successful? I believe you state 1 month treatment for prescription and 2 months for herbal. Have you used a combination of both herbal and prescription at the same time? All right. So in some of my materials, I lay out a starting point that you can do for yeast treatments. And those two options are either doing diflucan coupled with nystatin, that's a prescription option. I give that a 90% chance that it will have the yeast problem taken care of within 30 days. Okay. All right. The other option I lay out is an herbal option, which could use a couple different products. One is a product called CapriPlus, another one called Phytostan. CapriPlus has in it some powder caprylic acid, and oregano oil. And then the Phytostan has in it some caprylic acid, CapriPlus has caprylic acid, garlic, and rosemary in it. Phytostan has powder caprylic acid, rosemary oil, thyme oil, and unlacinic acid in it. All right. So, and those are herbs. And I say, my experience says they work well about 80% of the time, but they're slower acting. They take about 2 months. Okay. How do you know if you're done treating? Well, you follow your yeast symptoms. And so as I said, I know yeast produces cytokines and gives you a lot of the fatigue, body ache, etc. But also there are some symptoms that are unique to yeast too. So for instance, marked sugar cravings, having a lot of intestinal gassiness and bloating. Yeast also release toxins that interact with the skin that can lead to pimples and acne. Women that tend to have intestinal yeast overgrowth will also have problems with vaginal itching and vaginal discharge sometimes. Okay, so you follow those. You follow sugar cravings. You follow gassiness and bloating. You follow what happens with skin and acne. And if they are all better, that means you probably got the yeast taken care of. Okay, even if all the other cytokine symptoms aren't better. And then can you do herbs and prescriptions? So what I will do sometimes, so with that diflucan nystatin combination, the stronger medicine is the diflucan, all right? And I couple it with nystatin, and that's because yeast have the ability to develop resistance to the diflucan. But if you throw in the nystatin at the same time, that limits the chances from it happening. Now, nystatin stays in the intestines. It has no systemic toxicity, doesn't affect the liver or the kidneys or anything like that. Diflucan sometimes can affect the liver a little bit. Although, I mean, in theory it can. I got to be honest with you, I've probably never seen anyone have liver problems on diflucan, and I use a lot of the stuff, okay? But in theory it could, okay? Now, nystatin is something that could be pulled out, and you could substitute in a Phytostan herb or a CapriPlus herbal product, okay? And when I'll do that is if I've got a person that has some issues with nystatin. One of the things that a side effect that can sometimes happen with nystatin is nausea. It's not that common, but when it does happen, you got to pull it out. And then rarely I'll have a person have allergic reaction to it. So in those two situations, instead of using nystatin with diflucan, I might do a CapriPlus 2 pills twice a day, or I might do a Phytostan 2 pills twice a day, okay? So Phytostan, everyone, is spelled P-H-Y-T-O-S-T-A-N. It's product by Integrative Therapeutics. And CapriPlus is capital C-A-P-R-I, capital P-L-U-S, all is one word, and that's by a company called Karuna, okay? All right. Good luck to you, Alexander. Hello, Brandy. Let's see. What infections or specifically what symptoms suggest to use methylene blue, and is there a significant Herxheimer from it? So my decision to use methylene blue is not driven by symptoms, okay? My decision to use methylene blue is that as part of my treatments, I want to add something that will treat for what is known as persisters. So let me talk about that real quick. So both the Lyme germ and Bartonella exist in growing phases and also in hibernator or persister phases. And the laboratory experiments would suggest maybe 10% of the germs can go into these hibernating states. And the trouble with the hibernating states is that they tend to ignore the standard antibiotics that we use, all right? So like the amoxicillins or the doxycyclines or the tenidazoles, they tend to ignore those drugs basically, okay? And so if you don't deal with these persisters, eventually they still trigger a lot of inflammation in the immune system, so you can stay sick because of these. And if you've wiped out all the growing phase of the germ, and you still have these persisters, when you stop your antibiotics, they go back into the growing phase and you still have problems, all right? So one of the current ideas in Lyme disease as to why some people don't get well and why some people have a hard time getting over this thing is that there are these things called persisters. And for a number of years, we just didn't know it. It was about 6 years ago, some of the initial research came out showing that Lyme has persisters. And about 3 years ago now, there was some research that came out at Johns Hopkins University showing that Bartonella has persisters too. Okay. Now, it's the current idea that many of us have that the way to get somebody well is to deal with both the growing and the persisters. I have to tell you, we still don't know if that's true. I think many of us in the Lyme world are treating persisters because we're trying to limit any possible way that this germ can eventually be active in you again. So I do it as part of my treatment. So a typical way that and then one other thing. So terminology gets confusing here, okay? So we have growing phase of the germ, and then we have hibernating phases of both Lyme and Bartonella, okay? And in addition, Lyme has a bunch of different appearances, the way the germ looks, okay? So Lyme has spirochete, that's the thing that looks like a corkscrew. Lyme has microscopic cyst, and Lyme has a form where it moves inside of cells and lives in cells, sheds its covering, and we call that the L form, okay? Now, the spirochete form and the cyst form can either be growing or persisting, okay? So I want to be clear. Some people get confused and they think the cyst are your persisters. No, the cyst is just another form that can be growing or persister. In terms of that L form that I was talking about, we have no research saying what happens to the germ in the cell. I don't know whether they're growing or hibernating inside cells. We just don't know. Okay. All right. So, So when do I decide to use methylene blue? Well, generally when I design my treatments for Lyme or Bartonella, in addition to putting people on things that kill the growing forms, I want to have them on something to treat persisters. My first line approach is to include cinnamon, clove, oregano oil capsules. And there's compelling research that came out of Johns Hopkins University showing that's effective against both Lyme and Bartonella persisters, and even can help with the growing forms of the germs too. The product I like using is something called liposomal cinnamon, clove, oregano, and that's that product is produced by Dr. Inspire Formulations. I carry it at my supplement store if you're interested in that, okay? If that doesn't work, if it's not tolerated or doesn't work, then I'll entertain either looking at using Cryptal Lapis or Japanese knotweed. Those are herbs that Johns Hopkins has shown that are effective at growing and persister Lyme and Bartonella. The crypto is interesting. It also treats babesia too. Okay, so I might add those in. Or my next step would be to consider adding in a methylene blue to treat my persisters, okay? But usually I'm going to go for it if the liposomal cinnamon, clove, oregano is not tolerated, or if a Cryptal Lapis or if a Japanese knotweed is not tolerated, okay? All right. And then one other wild card in this. If it's a person that has pure Bartonella, the Johns Hopkins experiments that got published 3 years ago suggest that one of the azoles, so diflucan is in a family called the azoles. So the azoles are a lot of our yeast medicines. But in the Hopkins experiments, they took one of these yeast medicines called clotrimazole, which is only used in topical vaginal yeast creams and skin creams. And they showed that clotrimazole was quite effective against Bartonella persisters. They didn't look at it against Lyme persisters, okay? But they showed that that clotrimazole is very effective against persisters and growing forms of Bartonella. Well, clotrimazole is not available in a pill form, but its brother or sister called diflucan, fluconazole is, and itraconazole, another yeast medicine, is. And about 9 months ago, I kind of went back and relooked at that Johns Hopkins experiment data. And I thought, if one azole works, maybe another one will. All right. And so since then, I've been adding in, when I want to use something that's a persister, I've been using, and it's just Bartonella, I'm not dealing with Lyme. I will use fluconazole along with a doxy or along with the clarithromycin as a full Bartonella treatment. And that fluconazole is picking up your persisters. and I don't need to use a liposomal cinnamon clove oregano then. Okay. All right. So I know this is all very confusing. Probably what you want to take a look at for more information is an article I've written. I'm going to show that article to you. So this is my information site, Treatline by Marty Ross MD. And under my infection treatment plans tab here, take a look at this article I have that lays out various treatment options you have to treat Lyme and Bartonella persisters. Okay. All right. Oh, one other thing while I'm here. So this is my supplement store, Marty Ross MD Supplements. This is where my patients get their supplements. My shipping facility is actually down in Austin, so I have a pretty good reach, pretty quick reach to most of the country down there. And anybody can buy from here, okay? So if you're interested, you can use the site for two reasons. Number one, if you're wondering which products I recommend, which ones I've tried that I see good benefit from, and that I've researched to make sure they have quality ingredients in them, take a look here. You could, like, for instance, if you're interested in what curcumin products I carry, you can type in curcumin up here. And it shows you Mariva 500, curcumin pure. Those would be the two big ones. And these would be my main curcumin products, okay? And you could use this as an example to find products, okay? And you can buy it from here if you want to. You don't have to, but you can, okay? But in terms of these herbal products that I mentioned for persisters, so the liposomal cinnamon, clove, and oregano is this product here by Doctor Inspired Formulations. Okay, 1 capsule 2 times a day. The other two things that you can use that I've been using herbally to treat persisters are herbal antibiotics, and they're made by a company called Montana Pharmacy. Okay, and one of those would be the Cryptal Lapis that I mentioned. That's this product right here. And when I use it for persisters, I work up to a teaspoonful 3 times a day. I just want to warn you, this is a very strong tasting herb, okay? But it works well. I'm having really good results by putting people on this herb. All right. And then the other one that, again, is carried by Montana Pharmacy, produced by Montana Pharmacy, is good old Japanese knotweed. And this one, I try to work up to 30 drops 2 times a day. Okay. All right. Thanks for the question, Brandy. Oh, and do people Herx on methylene blue? Yeah, sometimes they do. One other thing about methylene blue, too, it's not 100% sure the method by which it works, but what we think happens is it actually gets into the covering of germs and destabilizes them. And because it destabilizes a germ covering, it doesn't need a growing germ to work, okay? Most antibiotics do better if the germ's growing, right? But in this case, it destabilizes a covering, so the germ just kind of breaks apart, basically. So it doesn't need to have a growing germ to work, although it will work on growing germs as well, too, okay? And then one other thing, before you use methylene blue, there's a blood test that has to be done. It's a blood test called a G6PD. That's an antioxidant that's found in the middle of red blood cells. If you have low levels of G6PD, you don't want to do methylene blue because you could rupture your red blood cells doing that, okay? So that should be checked. And then there's, in terms of side effects, one of the big side effects is that some people get bladder or bowel irritation with it. I've seen that happen a couple times. What I do in situations like that, I just decrease the dose to half. Normally, I'm going to do 50 milligrams twice a day, but I will decrease it to half if I need to. And then finally, if you're on high doses of antidepressant medicines, it's probably not a good idea to do methylene blue because it can raise serotonin, just like a number of the antidepressant medicines do, and you can get toxic on your serotonin. So you have to be careful with that as well too. Okay, all right. Good luck to you, Brandy. Hello, Thomas. Let's see, what's your opinion on Morgellons? It definitely has an additional set of symptoms beyond the typical Lyme disease, although there's some overlap. There appears to be a fungal component to it. Are there any treatments you recommend for that? So Morgellons, everyone, is a skin condition that has people have a bunch of sores on their skin, and they also describe having filaments come out of those sores, okay? When we look at who gets it, about 90% of the time that somebody has Morgellons, they will test positive for Lyme disease, all right? So we tend to think of it as an illness that is part of Lyme disease. And I'm in the camp of people thinking it's a skin manifestation of Lyme disease, okay? Now, when the filaments and also the skin has been studied, we can't identify any germs that are causing it. I mean, there are people that postulate that it might be a fungus, but in the laboratory, we've never been able to clearly identify if there are any exact germs in those lesions. We can't even correctly identify what the filaments are either, okay? What I have found in my practice is that if I treat the Lyme disease, whatever this skin manifestation is will go away. And I don't use any of the topical or oral anti-parasitic medicines. I know some of my colleagues will do that because they think it is parasite or they think it's fungal. The truth is we don't know. So I have found that if we just treat using the standard things I would do to treat Lyme disease, this kind of things I lay out in my Ross Lyme disease protocol to go after Lyme and co-infections, the skin will resolve 100%. That's what I have found in my practice. Okay. All right. The other group of people that tend to get Morgellons, maybe people with HIV. So Morgellons probably has something to do with a skin breakdown, and maybe due to organisms that normally live on the skin, probably due to immune suppression, either of HIV or predominantly in Lyme disease. Okay. All right. Thanks for that question, Thomas. Happy autumn. Yes, it is. You know, it's interesting. I realized that we tend to think of the equinox as being yesterday, but actually it wasn't until today that things flipped. And we can see it here. I'm looking out my window. I'm starting to see some of the leaves turn here. And it's starting to feel a little bit of crispness in the air. So thank you for that. I appreciate that. Let's see. Are there any medications, herbs that are effective at healing the vagus nerve? Pepsid AC. 2. Have you seen any side effects from using licorice tea long-term to treat Epstein-Barr, CFS, and Lyme? 3, do any of the tick-borne illnesses make your eyeballs or just one eyeball hurt really bad? So in terms of eyeball pain, I don't think of any one of the infections specifically giving eyeball pain. I have seen people with a number of the different infections like Lyme, like Bartonella, like Babesia, have eyeball pain, but I'm not able to determine specifically when people have eyeball pain, is it Lyme or is it Bartonella or is it Babesia? But I do think it can be a manifestation of tick-borne illnesses. Okay. In terms of using licorice tea to treat EBV, CBS, or CFS and Lyme, the only thing is, it depends on what you're doing with your licorice tea. So if licorice has some chemicals in it that can lead to elevated blood pressure, okay, that would be the main concern. Now, sometimes if you do herbal licorice, that's not a tea. They'll process out chemicals called something called a glycyrrhiza group. And if you remove the glycyrrhiza group, that decreases the chances, or that makes it so you don't get high blood pressure from it. Okay, but that's the only thing I'm aware of. All right. And then let's see here. So I'm not clear if Pepsid AC would have anything to do to help the vagus nerve. All right. But if the vagus nerve is affected in Lyme disease or in Bartonella, it means it's probably been infected by those germs. It can also be irritated by Babesia too. So step 1, treat your germs. Okay, kill your germs. All right. Number 2, things that can help support nerves that are inflamed and also help them heal. There are 2 things. Number 1, one of those things is to lower your inflammation chemicals. And for that, I like using the curcumin, which is also, I like using the Thorne product called Mariva 500. So that decreases the cytokines that lead to nerve inflammation. And I would take it as 500 milligrams 3 times a day. Okay. Number 2, I like working with glutathione. Glutathione is a very strong antioxidant. It's made in every one of our cells to repair damage that occurs to these cells from the inside, okay? And it has good data showing it can help with neuropathies, basically. So I like using a liposomal variety of that. Liposomal means it's microscopically wrapped in fat to increase its absorption. And the product I like using for that is a product by Research Nutritionals called Trifortify. If you take a teaspoonful once a day, that can help too, okay? Finally, if you've got significant nerve injury and it's not getting better by killing your germs and it's not getting better by using glutathione and curcumin, then you might want to start thinking about repairing the nerve membrane, okay? The nerve membrane is made up of, the nerve cell membrane is made up of a double layer of fat. We call it a bilipid membrane. And and when you can repair that doing a process called phospholipid repair, okay? And so what's good at that is to use, or what I've had success with that is using a product that has phospholipids in it that can help. And that is a product by Research Nutritionals called ATP 360. And you would do 3 pills 1 time a day. In that ATP 360, there's phospholipids that can repair the membrane of the nerves, but also can repair nerve injury. The mitochondria that are in the inside. Mitochondria are energy factories, so it can help them work better too. Okay. Now and then also that ATP 360 has a number of micronutrients in it that are helpful too. Keep in mind the ATP 360 has, one of the nutrients it has in it is coenzyme Q10. And if you are using something that has a atovaquone in it, like Mepron or Malarone, to treat babesia, you don't want to be on CoQ10, okay, because it'll make the atovaquone not work. So if you're on one of those, instead of doing the ATP 360, you would want to do something called NT factor that is phospholipids also, but doesn't have any coenzyme Q10 in it. And the way to do that would be to take NT factor 2 pills 3 times a day. Okay. All right. All right. And then finally, if you do all that and you say you're 4 months down the road, and you're still having nerve problems, then I think you might want to start looking at doing a peptide therapy. And that is to use an oral peptide product called BPC 157. BPC 157 is a peptide that is made in the stomach lining and has good evidence to show that it can repair damaged tissues, whether it's joints, tendons, ligaments, muscles, or nerves. And so it can help repair some of that damage as well, too. It can even help your mitochondria work a little bit better, too. And there's a company that's making it in an oral form. That company is called Integrated Peptides, and the dose on that is 1 pill twice a day. Can be quite helpful. Okay, all right. Oops, there he is. That's Mr. Thor. That's one of my Basenjis, Mr. Thor. His sister Halo is sleeping away under the desk here. She's getting quite old. She's actually, for those of you that have seen Halo before here, she's actually 14, coming up on 15 here pretty soon. And Thor, generally he's doing well except for falling off chairs every now and then. But Thor is coming up on about 14. So I've got 2 aged Basenjis. He's going strong now. But Halo's under there sleeping away. Anyhow, I had to say something about my Basenji because they hopped up over there. All right. All right. Good luck to you, Autumn. Oh, one last thing about peptides. So peptides are starting to become one of the newer things that many of us are starting to use in our Lyme disease treatments. And basically what a peptide is a string of amino acids that is less than 40 amino acids long. If it becomes more than 40 amino acids long, that has been classified by the Food and Drug Administration as a protein. Okay. There's different peptides that are made by different organs, and they all have different things that they can do. But the Swiss Army knife of peptides is this thing called BPC 157. It supports the immune system and repairs damaged tissues, basically, of about any kind. Okay. So anyhow, just keep that in mind. It can be given by injection, but also is available orally. And that's made by a company called or Integrated Peptides. I carry those at my supplement store as well, too. Okay. All right. Hello, Albert. Let's see. My doctor's data, toxic and essential elements, hair analysis came back elevated for uranium and silver. the uranium was undetected in urine and the silver was not screened for in the urine. In your opinion, is this something one should act on? If so, what would you suggest? A product called Ultifend by Holistic Health has been suggested. Any thoughts on this? Can I use a binder to detox from this? And if so, might I get a cytokine reaction? Also, the doctor's data urine amino acid test came back low in almost everything for me and another family member. One of us had Lyme and one hasn't. The uniformity of low levels for both of us makes us a little skeptical about accuracy. Do you have any experience with this test or confidence in it? So I have to be honest with you. I don't do amino acid testing, so I can't say whether it's a valid lab or not. I just haven't looked into it before. And then in terms of your heavy metal toxicity, this is one of those situations I would refer. I don't know what to do with this, because if your urine is clear, or if your urine sample was clear and it's just in the hair, I'm not sure what to make of it. I'm fortunate in that in my practice, I have a naturopath who focuses, is very strong in heavy metal toxicity. I would get her opinion on this, or I might refer to one of the environmental health specialists in town, a physician out here named David Boucher, and see what his take would be on it. But I don't know what I would do with that off the top of my head. I'd have to consult myself to see what to do with it. Okay. All right. Good luck to you, Albert. I'm sorry I wasn't able to help you here. Hello, Lynn. Hi, Dr. Ross. On a recent webinar, you said that one of the side benefits of curcumin is it decreases quinolinic acid, which increases neural inflammation. Can you say what kinds of things increase quinolinic acid and other ways to decrease it, protect against it? Also, should I separate CapriPlus from Saccharomyces boulardii? Finally, I'm interested to hear if there's any new information from your peptide conference about other peptides in addition to BPC 157 that might aid in the healing of a torn meniscus. That's interesting. Okay. So in terms of the, let's take these in order here. So quinolinic acid is an inflammatory chemical made in the brain that some people think gives a lot of the brain fog, that quality of fogginess, okay? And the only thing I know that curcumin works against it. I'd have to look into this. Maybe Japanese knotweed. I'm not sure about that though, okay? But curcumin, I'm not aware of anything else that does. Maybe knotweed, but I'd have to investigate that a little bit more. I don't know that off the top of my head, okay? In terms of the CapriPlus and Saccharomyces boulardii, that's a great question, actually. So everyone, Saccharomyces boulardii is a healthy yeast that lives in our intestines, that is a probiotic you can take to support intestinal health, and especially useful if you've had problems with a C. difficile bacteria infection before. It helps to treat it and can actually lead to prevention of it too. I also find it helpful in people that are having a lot of diarrhea while on antibiotics and regular probiotics aren't helping them. Sometimes if you add Saccharomyces boulardii in, it will help too. The major source of it is a company called Thorne. They have a product called Sacro B. Okay. All right. Now, because it's a healthy yeast, you have to wonder if something like CapriPlus that's designed to treat yeast, mainly Candida yeast, but you have to wonder, would it kill this? And so generally in my treatments, I do try to keep my Saccharomyces boulardii away from the time that people take CapriPlus. So what I might do, usually I have people take CapriPlus in the morning and at night. So somewhere in the middle of the day, I might have them take their Sacro B, okay? And I usually recommend about 2 pills one time a day, okay? You know, in terms of tissue repair, again, the main peptide that would do that is the BPC 157. At my workshop this weekend, which was 4 days, 3 days of peptides, it's part one of a 2-part workshop. Part 2 is in Vegas in December. The only one we got into that would do this kind of tissue repair at this workshop was the BPC 157. And I'm not aware of anything else that would do that. Now, in the workshop that I participated in, one of the things that they often would add in when they're trying to do tissue repair is you want to make sure that you're doing two other things. One is supporting collagen. Collagen is a protein that is involved in cartilage health, and also consider adding glucosamine sulfate. So two other supplements that are not, well, collagen you would take as a peptide, actually. So I'd take that back. You would do another peptide, collagen peptides, okay? So there's a collagen peptide product at my website called Collagen Plus. You could add that in. Glucosamine sulfate is a supplement that is considered to be a building block for cartilage. And so you would take that as a 500 milligrams 3 times a day. So my outcome from what I saw at this workshop for my joint repairs that involve cartilage, I'm planning on working with BPC 157, starting at 1 pill twice a day. It may work up to a total of 2 or 3 pills 2 times a day. And I would couple that with glucosamine sulfate, 500 milligrams 3 times a day. And then I would do a Collagen Plus by Thorne. That's my collagen peptides product. And I would do 1 scoop of that 1 time a day. Okay? All right. Thanks for that question, Lynn. Good luck to you. Hello, Joyce. Please explain the major differences between Cryptal Lapis and Cryptal Plus. I purchased this by mistake. I'm having a difficult time taking this. I have added this to Sitta Akuta, Hutania, Otoba, and Cat's Claw. I had worked my way up to 10 drops, but realized I'm going down the same path I did in 2016 when I first took Cryptal Plus, where I felt like I was losing my mind literally taking this. I never in my life had any depression, etc. issues, but I had gotten to the point where I felt suicidal. I stopped taking Cryptal Lapis back then and everything got better. Do you have a suggestion? Thank you. All right. So Cryptal Lapis is one of the herbs that is in the product called Crypto Plus. Okay. There is also a pure Cryptal Lapis product I carry at my website made by Montana Pharmacy that is just the herb Cryptal Lapis. All right. So the other things that are in Crypto Plus may also kill Lyme and I think can do Bartonella too. Let's go look at the product page together. Although I carry the Crypto Plus, I tend to use the Cryptal Lapis pure product by itself. That's by Montana Pharmacy. So bear with me here. Oh, actually, let me do a screen share and then we'll look at this together. Okay, so let's look up. Okay, so the Montana Pharmacy product for Cryptal Lapis is here. Okay, and all that this is Cryptal Lapis, nothing else. Okay, so it's Cryptal Lapis, sanguinol. I can never say the last word. We'll just call it Cryptal Lapis for short. Okay, all right. But what you got is a research nutritionals product called Crypto Plus. All right, which has as one of its components Cryptal Lapis, which is probably the major component. But the other things in it, I'm just going to read them here, is red root, black walnut, lomadium, and Stellengia. Okay, so this has broad, this deals with a number of things. The black walnut has been known to kill other parasites. Red root may improve the immune system function, may help with blood flow and lymph flow. The lomadium can be antiviral and may help with some extra coagulation. And the Stellengia helps support your lymph system. Now, I tend in my own practice to use single herb products that I can start and stop so that I can figure out when somebody's having a reaction, what are they reacting to? All right. So even though I carry the Crypto Plus at my store because a lot of people like using it, that is not what I tend to use in my practice. I tend to use single herbs products so that when somebody is having problems, I can start and stop and figure out which one of the things they're having a problem to. Okay. And I use a lot of Cryptal Lapis, pure Cryptal Lapis from Montana Pharmacy. I haven't had somebody describe the situation symptom-wise you're having. I can't guarantee if you got that product that you wouldn't have the problems just on pure Cryptal Lapis, but it's confusing because that Cryptal Plus has other herbs in it that you may be reacting to and not the Cryptolepis by itself. Okay. All right. Good luck to you, Joyce. Hello, Ben. Let's see. I've noticed some of the Lyme literate doctors in my area have started to treat for parasites more frequently now because it's believed that nematodes are a recurring reservoir of many of these infections. What's your opinion specifically for folks that have been on antibiotics for years? I know some people are doing. I just don't buy it. I've looked at the research. I just don't think it's fully supportive of it. I have a different opinion. Okay, so that's where I'll leave that one. Yeah. Hello, Anna. Let's see. Do you recommend supplementing with manganese for people with Lyme disease too? Have you attempted to treat Lyme predominantly with peptides? Thank you. So in terms of the manganese, I tend to use the amounts that you would find in normal vitamins. I tend not to excessively supplement it. Okay. So yeah, I'll use it, but I use it more in normal vitamin amounts as opposed to doing higher amounts of it. Okay. And then in terms of peptides, I haven't, and I don't, even with my training that I've been getting on it, I don't think I will. All right. So I think peptides are good at supporting your immune system to work better. I think they can deal with a lot of the inflammation people get in Lyme disease. There's various ways of doing it. Some of them, like KPV, can help with the mast cell. There's an injectable peptide called MOTS-C that can help repair your mitochondria. The BPC-157 fixes all kinds of tissue damage. You've got thymosin alpha-1 that can help turn on cells to fight infections. You've got there's things that can help, but in terms of true germ killers, and that's where you still need to go. You need to kill your germs still, all right? And the germ killers that are in peptides, you've got something called LL37, which can kill germs broadly. BPC-157, KPV are weak germ killers, but I don't think they're strong enough to go after Lyme, and I don't think the LL37 is strong enough to go after Lyme either. So I think you could use peptides to boost the immune system and fix damage, but I don't think somebody's going to get all the way well unless you kill those germs. And I think ultimately you're left either with herbal antibiotics or prescription antibiotics to do it. If we look at previous research that was done by the Lyme Disease Association, LymeDisease.org out of California, they run a project called My Lyme Data. And they ran a study a couple of years ago. So basically what they do is they try to recruit people that have had Lyme and have Lyme, and they periodically query them with questions to answer certain questions. All right. So their study 2 years ago, and right now I guess they're up to almost 14,000 people that are signed up in their database. But their study of maybe 2 or 3 years ago now queried people to find out what alternative, or maybe this one was 2 years ago, queried people to ask them, what is it that got you well? Okay. And there were two main findings that they found in people that got well. All right. Number one, the people worked with a Lyme literate doctor that could help dance through all the complications. All right. And number two, they used long-term antibiotics. It wasn't Rife machines. It wasn't stem cell treatments. It wasn't all these alternative therapies. It wasn't immune boosting. It was killing your germs. Okay. And what they found is that people that stuck with antibiotics, they didn't ask them if they did herbal antibiotics, but these were probably, the study was just looking at prescription antibiotics. I think herbal antibiotics can do as well in many situations too. Okay. But what the finding was, you need to be on germ killers that target Lyme, and you need to be on them for a year or more. Okay. That was the finding. Doing germ killing with germ killers like antibiotics, and I think herbal antibiotics could be in there, coupled with working with a Lyme literate doctor that can help dance through all the other complications with you. Those are the things that got people well. All right. Now, peptides are new on the block. But again, I don't think, especially from the data I saw this weekend, there just isn't enough data to tell me that you're going to get adequate germ killing by just supporting the immune system to do it, or by using an L37 or some of the weak antibiotic properties that a KPV or even a PPC 157 might have. Okay? All right. Thanks for your question, Anna. The other problem with peptides, they are expensive. The oral ones are expensive, but you start getting into the injectables, they're really expensive. So I don't know how somebody is, other than the really, really well off, how people could afford to design everything using peptides, to be quite honest with you. All right. Good luck to you. Hello, Frank. Dr. Ross, one of the most troubling symptoms my wife has experienced with Bartonella is air hunger. Can you explain how the disease causes the specific symptom, and if anything can be done to help alleviate it while we work towards reducing her bacterial load? If it is solely related to excess cytokines, wouldn't it be a symptom of Lyme as well? Thanks. So the air hunger that people have with Babesia is perplexing. I don't think it's a cytokine symptom because you're correct. We would see it in Lyme. The other disorder, so one of the reasons you can get air hunger in Babesia is Babesia sometimes can cause anemia. And if you have anemia, you don't have enough red blood cell hemoglobin to carry oxygen around, you would have air hunger from that. Okay. That's one reason. All right. But most people with Babesia don't have anemia. But if you have anemia, that could be one reason. Okay. The second thing is when you have Babesia, it affects the vagal nerve, which is regulating your adrenaline and anti-adrenaline. And if you have a high anti-adrenaline state that sometimes occurs, that also can lead to some air hunger. Okay. And then third, another reason people with Babesia might get air hunger is that Babesia has the ability to weave itself into a blood clotting protein called fibrin. And same thing can happen if Bartonella is on board too. So Bartonella and Babesia can mix with fibrin and create these what are called fibrin nests, okay? And kind of think of it as fibers woven with germs. And then they stick themselves on your red blood vessel walls, narrowing the opening of your red blood vessels. So especially in the really small ones, you've got blocked blood flow to the tissues, partial blocked blood flow to the tissues. That produces air hunger as well too. Okay. Those are some ideas, but I'll be honest with you, other than the true anemia that sometimes people can get, I'm postulating on why. We don't really know why. All right. But those are some possible reasons why. And generally, as you get the Babesia under control, probably 99% of the time, the air hunger will go away. I have had one patient in my experience that just had air hunger and we could not get it to leave. Even after we did full-on Babesia, Bartonella, fibrin nest treatments, etc., sent him off to pulmonary. They did testing out the rear end on this poor person, and we still couldn't come up with a reason why this person experienced air hunger like they do. But that's a rare person, okay? Anyhow, those are my thoughts on that. All right. Good luck to you, Frank. Oh, and good luck to your wife, too. Oh, in terms of what to do about these fibrin nests. So the other condition that gives air hunger is Bartonella can give air hunger, too. And I think in Bartonella, the reason is you get these fibrin nests with Bartonella stuck on the blood vessel lining, okay? So do a quick screen share here for you. All right, so take a look at my Babesia guide. So it's called Hills Babesia, a brief guide. All right, and in here, I lay out steps that you want to take basically to get over Babesia. Do things to boost your immune system. Be on combination antimalarials to kill the thing off. And then let's see, I list those out. And then the third step is get rid of your Babesia nest, okay? And so what I like using for that is an enzyme called lubrikinase. You can take it 1 pill 2 times a day. There's some people that advocate even working up to 2 pills 2 times a day. Beware when you start this, you can get some pretty significant Babesia Herx reactions. So be careful with it. I used to start everyone at 16 milligrams twice a day. As I've worked with it, I generally start it once a day, let a person adjust, and then try to work up to twice a day on that. Okay? All right. In terms of, there's other enzymes that can break up the fibrin too, but nothing is as strong as the lumbar kinase. Okay, so your serrapeptases, your natokinases, they do not work as strongly as the lumbar kinase does. Okay, all right. Hello, L. So L says the reaction that Joyce had on Cryptal Plus may actually be from the lomatium. Thanks. I don't know. I haven't looked into that before, but thank you for that information. Joyce, take a look at that. You may even Google it and see what you can find on that. Okay? All right. Thanks for that input. I appreciate that, L. Hello, Shanna. Let's see. Question. I think I heard you say to take probiotics once a day, 2 hours away from antibiotics, either before or after. I feel like I have to take it 2 hours after each antibiotic dose based on my assumption that each antibiotic dose will kill good and bad bacteria, so it would negate the probiotics. All right, Shanna, I think you know this is a third webinar where you've asked me this question, and I'll answer it one more time, but I'm not going to answer it again, okay? Or a derivative of this, all right? So the thing is about antibiotics and probiotics, the antibiotics can kill the probiotics, all right? The best you can do is to take it as far away from an antibiotic as you can. That's the best you can do. You're still going to kill off some of the bacteria in that probiotic. It's just going to happen, okay? So, for instance, if you're taking an antibiotic, your antibiotics in the morning and at night, take your probiotics in the middle of the day, okay? If you're on a regimen where you have to take antibiotics 3 times a day, morning, middle of the day, and night, then somewhere in the middle, when you take your morning and your midday antibiotic, take your probiotic. Or if you happen to have more time between your last antibiotics of the day and the middle of the day antibiotics, take your probiotics somewhere in the middle, okay? I wouldn't get so exact about counting 2 hours. It's the idea of taking it as far away as possible away from your antibiotics, okay? And if all that possible is an hour and a half, well, then so be it. You got to still take them. You're still getting some benefit from it, okay? All right. Good luck to you, Shannon. Hello, Gemma. Hi, Dr. Ross. I used to have a burning face as a symptom, which would come and go with different symptom cycles. Lately, it has been constant. My face feels sunburned despite having had no sun. Any idea what may be causing this? Also, is milk thistle okay to take while on antibiotics? Whilst on antibiotics, that is. You must be from the UK, I think, with that. I worry it may clear them out too soon. All right. All right. In terms of burning, a sunburn feeling, so first of all, you can have increased sun sensitivity, even a feeling of sunburning if you're on tetracyclines. So I'm not sure if you're on tetracyclines or not, but if you are on tetracyclines, you may want to reconsider being on those, okay? Number 2, a feeling of burning can sometimes be due to nerve injury. So that could be a symptom of nerve injury. And if that's the case, doing things to repair your nerves, like being on glutathione, could help. I would need to ask you a lot more questions to figure out if that's a possibility with you. This is something you really should be talking with your doctor about to see if they have some ideas for you, okay? But nerve injuries sometimes can be due to this. Other than that, I don't know, okay? And then in terms of milk thistle, so milk thistle is an antioxidant that helps support liver detoxification. Taking it is not going to turn your liver on too much to clear the antibiotics out of you quicker. So it's okay to use in this situation. Okay. All right. Good luck to you. Hello, Karen. Are high VEGF levels indicative of Bartonella? Is this a reliable marker for infection? So VEGF is a chemical that's made by red blood cell linings, and it can be elevated if you have Bartonella. It can also be elevated if you have mold toxicity. I haven't seen any studies to indicate whether it could be elevated from having Lyme or not, but having elevated VEGF is a situation we see in Bartonella, but it is not diagnostic of Bartonella, again, because you've got mold toxicity possibilities, and there may be some other things that cause VEGF to go up as well, too. Okay. Thanks for that question, Karen. Hello, Andrea. Let's see. Can die-off from Bart and Lyme cause inflammation in the stomach? Seem like once a month I get nauseous, stomach burning, bloating, gas, and loose stool. It lasts 3 to 5 days. I've tried Pepsid and other medication. It just makes it worse. Huh. I haven't seen anyone. I have not seen a situation. I mean, I've been treating Lyme disease since 2004. Yeah, 2004. I haven't seen anyone describe a situation like this before, so I don't know. And the thing I would be trying around that time of the month is I might try to use licorice, actually. Licorice is chewable licorice, deglycerated, where it has the glycyrrhizin chemical removed. If you chew deglycerated licorice, it actually provides a coating over your stomach to soothe any inflammation that's there. Okay, that might be something to try. The other thing that might give some benefit here, if that doesn't work, a BPC 157 is released by the stomach to heal the stomach and to heal the intestines. So that might be something to keep an eye on. You would do 1 pill twice a day on that. If you're going to do it for stomach burning, though, what I would want to do is make sure that it is the capsules that it comes in are designed to get it through the stomach. So if you were to want to take it in a capsule form for your stomach, you would want to empty that out into some water and drink it down so that it actually can have effect at the stomach level. Okay? All right. Good luck to you, Andrea. Hello, Andrea. Again, let's see. I've been treating with herbs for 7 months with no breaks except for this week. I stopped for a few days. After 2 days, my neck pain and dizziness got so much worse it was unbearable. Is it possible for symptoms to come back quickly after stopping treatment? So, yes, but let me kind of look at that with you for a minute. So, any antibiotics that we use, even if they are herbal antibiotics, have some anti-inflammatory effects. And so when you stop something like prescription or herbal antibiotics and symptoms come back right away, like you're describing, I tend to think that what's happened is you still got a lot of inflammation going on. Okay. On the other hand, if we look at symptoms returning, in the situations of Bartonella, if you've stopped a Bartonella treatment early and the germ is still in you, Bartonella replicates every 24 hours. So usually over the course of a week to even 3 weeks, you'll start to see symptoms come back. But the way that these came back so quickly makes me wonder more if you lost the anti-inflammatory properties or effect of having stopped the herbal antibiotics that you were on. Okay? All right. Good luck to you. Let's see. Ampicillin, same as amoxicillin. I was prescribed ampicillin and azithromycin. So, ampicillin and amoxicillin are, I believe they're actually different, but they work the same way. Hold on here. I want to look something up here. I use all amoxicillin. I haven't used ampicillin in a long time, so I have to look this one up. Just bear with me a minute. I should know this, but I don't know it. I use them interchangeably. I think they may be separate drugs, though, amoxicillin and ampicillin, but we would use them interchangeably. Okay. And I would have to Google differences between ampicillin and amoxicillin. They work similarly. I don't even know if they're anyhow. I would say we use them interchangeably. I don't know off the top of my head right now without doing more of an internet search as to whether they are technically different drugs or not. I tend to classify in my mind as being interchangeable with each other. Okay? All right. Thanks for your question, Paula. Hello, Mary. So you mentioned that the way to kill Lyme is antibiotics. Do you include those who have had the microbes in their system for many years becoming a chronic condition? I was with a Lyme literate medical doctor who gave me a rotation of antibiotics for 18 months. I did not get better. I got much worse. This set me up for chronic C. difficile and gut issues that still struggle greatly with 7 years later. The only thing that took care of my Lyme, Bartonella, or Borrelia, and Babesia was a good herbal protocol. The antibiotics nearly killed me, literally. Thank you, as you, Mary. Mary, yes. So in the study, these were looking at people with chronic Lyme, not acute Lyme. Okay. And as I said, and so there are, I, in my own practice, use herbal antibiotics and prescription antibiotics interchangeably. My preference more and more is if I can use herbal antibiotics, I will, because I think they tend to do less destruction of the gut microbiome. Now, I offer patients choices, though. I do think that for most people, the prescription antibiotics, prescription antimicrobials for Bartonella and Babesia have a slightly better chance of working than the herbs. When it comes to Lyme, I tend to think that in my practice, herbal antibiotic protocols can work as well as prescription antibiotic protocols. And because of issues related to not wanting to injure the gut microbiome, I'm leaning more and more towards suggesting to my patients, they ultimately choose what they want to do, but suggesting to my patients doing herbal antibiotics for that reason. All right. So thank you for that point. I appreciate that. All right. Good luck to you, Mary. Hello, Danny. When I experience brain fog, type 2 brain doesn't work. My left eye remains partially shut. The physiological awareness of not being able to process and express thoughts properly often sets in suddenly, like turning off the lights. The only method I found that's been able to reverse both is NAT kinesiology. Do you know about NAT, and do you have any other treatment options? So, Danny, I would want, so NAT can be helpful in situations like this. But I'd want to ask you a lot of questions here. If you get severe brain fog and it always is associated with some loss of the ability to shut off your left eye, just off the top of my head, I would start wondering about what we call a migraine equivalent. So if you get migraine headaches, usually there is a neurologic dysfunction that occurs with them. Not everyone that gets a migraine actually gets the headache. You can get, and we think migraines are caused by periods of limited blood flow to certain areas of the brain, and that part of the brain stops working as well. That could give you brain fog. That could give you loss of the ability to move your eyelid too. So anyhow, I don't know that it's a migraine equivalent, but I would want to ask you a lot of questions to find out if that's what it is. And if it is, there's things you can do for that. Okay. All right. Good luck to you, Danny. Hello, Kristen. Does Lyme cause autoimmune conditions, or does having an autoimmune condition make you more susceptible to getting sick from Lyme? Good question. There's a third part to that question is, can you have an autoimmune condition and Lyme separate from each other? All right. So, and it all comes down to what happened first, the chicken or the egg. I do see that a number of my patients with Lyme have autoimmune illnesses. And often as we treat the Lyme, their autoimmune illnesses get better. So there are a group of people that I do think that Lyme is the trigger of their autoimmune illness, okay? Now, if you have an autoimmune illness and it is a separate condition from Lyme, what I have found is that sometimes the symptoms of Lyme disease can be a lot worse, okay? Does it make you more susceptible to getting sick from Lyme? I think it would depend on the autoimmune condition. If part of your autoimmune condition results in immune suppression of your ability to fight germs, then yes. But not every autoimmune condition do you lose the ability to fight infections in a person, okay? So it is very individual in terms of that part of your question, okay? All right. Good luck to you, Chris. Hello, Henry. Hello, Dr. Ross. Which is better for getting rid of mold toxicity? Herbal binders like clay, etc., or prescription medications? Must herbal binders be taken for a longer period of time compared to prescription? Thank you. So it's not a matter of better. So cholestyramine, at one time, cholestyramine was all I used to treat my mold toxicity because we weren't aware, I wasn't aware back then, that different toxins sometimes will do better with different binders than cholestyramine, okay? And the drawback, though, to cholestyramine, and even if it is the appropriate binder for somebody to use, is you just get a lot of constipation on cholestyramine. And the majority of people, a lot of people can't tolerate taking more than 1 or twice a day due to that, okay? So if I've got a person that's having a lot of constipation issues or has a lot of constipation issues, I don't want to use cholestyramine. I'm going to tend to use more the herbal binders because it's better tolerated in terms of the gut. Now, the herbal binders can work as well at binding a variety of toxins, in some cases better than cholestyramine, depending on what your toxin profile is, okay? So let me show you where I've written about this. I do a screen share here. All right. So I'm in my detoxification section. Pick up my article on mold toxin illness here. And down here, I describe the different kind of binders you can use, okay? So in this section called specific binders, I write different binders work better on certain toxins than others, okay? So ochratoxins are bound best by cholestyramine and activated charcoal. Aflatoxins are bound best by activated charcoal and bentonite clay. So for instance, if your problem is mainly aflatoxins, you may not even want to use cholestyramine, okay? Trichosethines, which is black mold, are bound best by activated charcoal, but cholestyramine, pectin, and bentonite clay can help, okay? And gliotoxins seem to be treated best by bentonite clay, in which case you don't want to use cholestyramine, okay? So anyhow, you've got to look at what your toxins are to see what's actually going to be the best. But also, one of the overriding factors that I just described to you is that is the constipation issue. The other binders tend not to lead to as much constipation as cholestyramine does, okay? All right. Good luck to you, Henry. Hello, Colleen. Let's see. I'm going to be treating yeast for 3 months. Already taking HMF Forte. When I switched to a Candida diet and began taking core biotic sensitive and 1 phytostat per day, I had the hugest herx I've ever experienced for about a week. Severe weakness, couldn't make it up even 2 steps on the stairs. 2 weeks in, I'm over the hump now and the herx simmered down. I'm back to my baseline with fatigue and weakness, but without the intense food cravings, and my white tongue is becoming pink again. Yahoo, progress. I appreciate that. I'm a little nervous to go to 2 pills because of how hard I herxed. Should I start on 2 pills this week or wait a month or something else? Thank you for supporting us Lyme patients. I'm so grateful. You're welcome. So Colleen, make sure. So yeah, it sounds like you had quite a herx there, and you did that by starving your yeast by going on a low candida diet, and then also by killing them with the phytostam. So one thing you want to make sure you're doing is things to lower your cytokines, all right, which are being triggered by your killing reaction or your Herxheimer reaction. And they're giving you all excess cytokines are what are giving you all those Herx reaction symptoms, okay? So I would max out your curcumin. Again, I like using that Thorne product, Mariva 500. I would do 1,000 milligrams, which is 2 pills of that product 3 times a day. And I would consider doing the glutathione, the Trifortify glutathione product by Research Nutritionals at a teaspoonful twice a day. I mean, I would max those out, okay? And if you do that for about a week, then try to go up again. But instead of going up to, what I might do if I were you, after you do that, is I would, if you were my patient, what I would do with somebody with a situation like this, is I would consider adding a second pill in every 3rd day to start. Now, if you do that and even blocking all the cytokines down, you have a huge reaction again, then what I might do is just stay on 1 a day. 1 a day might be enough for you. It seems like it's clearing you up just fine. And you got to be careful. You know, too many cytokines, if you do that a lot, can lead to injury, basically. So there are times I will use like a small amount, like 1 pill a day to get somebody well. And you've got some evidence that it is working for you, okay? But it still might be better if you get up to twice a day if you can. But to do that, you need to block down your cytokines, okay? All right. Good luck to you. Thanks for sharing that too. Hello, Robert. Let's see, Dr. Ross. I just had a CBC and I'm concerned. My WC is mid-range. My RBC, hemoglobin, and hematocrit came close to bottom range. Also, MCV is high out of range by over 17%. MCHC, let's see. From a February 21 full chemistry, B12 and folate levels are fine, but T4 was rock bottom range and T3 very low. I've been on glutathione and ATP 360 for a year, plus multivitamin extra B12. I'm 70 and suffering with at least Lyme for 11 years from Connecticut tick bites. Along with neuropathy and many Lyme symptoms, I cross over with BART and BABS. I feel like I've been running down on fumes for the last several years. I also keep losing weight, maybe hypothyroidism, non-megaloblastic macrocytic anemia, or maybe Babesia is more likely. There are several other tests like blood smear, haptoglobin, hematocrit, etc., but I like the idea of asking my PC for a full pathology lab work done at the hospital. So, there's a second part here. Let's see here. Is there a particular kit I should be looking for in order to ensure I get data needed for clues on Babesia? I'm worried that I'm breaking down red blood cells fast as I make them. Thanks for what I do. All right. So one of the things that I would consider doing, and you'll have to see if your doctors agree with that too, is given this your concern of breaking down red blood cells and the way that the different how your CBC is appearing with what you showed me here, I might consider doing something called a peripheral blood smear, where you actually have the pathologist actually look at your blood under the microscope, and they'll be able to tell based on what that looks like whether you're hemolyzing or not. Okay. And in terms of Babesia, sometimes if you have enough Babesia, they'll be able to see it on that blood smear as well too. All right. To really answer more for that, I would need to know, ask you a bunch of questions about your health, and I would actually want to see the blood test report in front of me to see what kind of patterns would pop out at me from that too. Okay, but at a minimum, I might consider doing a blood smear. Okay, all right. Good luck to you, Robert. Hello, Mosby. Is there a distinction between psoriatic arthritis and psoriasis and Lyme? I have burning skin after tick bite. Is there a good first herb to start for sensitive people? So, so psoriatic arthritis usually has something, there's manifestations on your skin that would suggest to somebody you have psoriasis first off. And then if you get joint pains with that and you have the skin manifestations, they were likely to say you have psoriatic arthritis. That's kind of how we back into that, okay? I would need to know more about when you got your tick bite as to how it has influenced what's going on with your psoriasis and the joint pains you're having to help you figure out whether this is really Lyme or not. I can't tell from what you've said here. So to make a Lyme diagnosis, there's a number of things we consider. One is, did you have a tick bite? Number two, where did you get that tick bite? Were you in New England, where New Jersey, for instance, where almost 100% of ticks carry Lyme? Or were you in the middle of Nevada where there aren't many ticks that carry Lyme? Okay, so we have to consider what's the possibility you got it. I would want to know more about your symptoms beyond just your psoriasis, skin changes, and joint pains. I would want to know, do you have anything else that looks like Lyme? Do you have a lot of fatigue? Do you have brain fog? Anyhow, I want to go through a whole list of symptoms, right? And then I would want to look at testing to figure out, do you have any test that supports a Lyme diagnosis? Okay, so I would need to know more, all right? Good luck to you, Mosby. Hello, Sandy. Thank you for these webinars. How would you treat a patient with adrenal fatigue? Thank you. So if someone's got adrenal fatigue, I usually like to start herbally first. Well, actually, herbally and a couple other things. So from a lifestyle standpoint, I want to make sure that people are getting enough sleep. Okay, 7 to 9 hours of sleep allows, decreases the amount of inflammatory cytokines that your immune system produces that could be suppressing your adrenal glands if you have infections, okay? So sleep helps, all right? 7 to 9 hours of sleep helps, all right? Number two, one of the things that is a big suppressor of the adrenals outside of infection triggering cytokines is stress, all right? So I'd want to know what's your life like, what's going on stress-wise in your life, and how do you deal with that stress? And I want to talk with you about what you can do about that stress if you happen to have it, okay? All right. Number three, I'd like to put you on what's known as an adaptogen, or herbal products that are known, that have been shown to actually improve adrenal function. And one of those is ashwagandha. Ashwagandha has been used for thousands of years in Ayurvedic and in Chinese medicine because it's been observed to give people better energy. When we look at animal studies, we see that there is improved adrenal function. There is also improved thyroid function when you're on ashwagandha. And I usually start people on a 400 to 500 milligram pill, depending on the brand. The Organic India brand I use is a 400 milligram pill. And I have people take 2 pills in the morning and then take 2 pills between 1 and 2 in the afternoon. That tends to be how I like to do it, okay? So those are some things to think about. And the other thing is, if you have infections like Lyme or co-infections, treat those because they're causing your immune system to pump out cytokines that is suppressing your adrenal system as well too. Okay? All right. Thanks, Andy. Hello, Duke. Let's see, Dr. Ross. Do you ever recommend salvia, also known as red sage or Don Shen for your Lyme patients? This is one of the top herbs that Buhner recommends in his books. Also, do you think it could be useful to help treat circulation issues such as cold feet? If so, what would you say would be a good dose to take in a tincture form? I think I can say that everyone here appreciates that you're doing another amazing webinar for us. Thanks, Duke. Duke, I'm going to disappoint you here, though. I appreciate your comment. I haven't used any red sage, actually. I know Buhner does talk about it increasing circulation, but I haven't tried it in any of my patients. I would probably, if I had somebody that suspected circulation issues on, I might use it. Cold hands, cold feet could indicate some circulation issues. You might try it and see if it makes a difference for you. Okay. All right. Good luck to you, dude. Hello, Leslie. Is there a general timeline to begin seeing improvement once herbal supplements have been started? All right. So it depends on what you're treating. So if you're using supplements to get sleep, lower cytokines, etc., and you're killing germs at the same time, you may not see any improvement, because as you kill germs, you trigger more cytokines to be made, get a Herx reaction. So sometimes you'll go backwards the first month or two as you start treating Lyme and go infections if you're using germ killers at the same time, okay? In terms of the major infections, when we treat Lyme, what studies, an unpublished study tells me is something I actually see in my practice too, and that is with Lyme infection, an average in terms of how quickly do you turn around, one of the unpublished studies showed that by 3 months of people taking clarithromycin and Flagyl, those two antibiotics together, 30% of people started feeling better. By 6 months, 60% of people started feeling better. And by 9 months, 90% of people started feeling better. These are people with chronic Lyme. Okay, so for the Lyme germ, it can take a number of months. Okay, all right. For Bartonella, generally, if you're on a treatment that is killing the Bartonella effectively, by 1 to 2 months, you should start seeing a turnaround in your Bartonella symptoms. So those are the symptoms that are caused by Bartonella, okay? And in a Babesia treatment, usually by 1 to 2 months as well, you start seeing improvement in the Babesia symptoms, okay? All right. Now, you're probably wondering, what are Bartonella and what are Babesia symptoms? So, and then one other thing, Bartonella takes on average 4 to 6 months, and that works about 85% of the time. Babesia takes about 4 to 5 months, and that works about 85% of the time as well, too. Okay? Now, Babesia symptoms. Things that make you think of Babesia are drenching night sweats, lots of air hunger, panic anxiety attacks, racing and skipping of the heart, headaches in the front of the head. Those are some things, okay? Bartonella symptoms can be severe cognitive impairment, much worse than the amount of energy impairment, okay? Neurologic syndromes like shaking, tremors, seizures, a feeling of internal vibrating, mental health problems like ongoing anxiety or depression, and then the bad thinking. Okay, so and then a rash that looks like scratch marks. Those are things that make you think of Bartonella. Okay, all right. Good luck to you, Leslie. Hello, Jake. Hi, Dr. Ross. Thanks for taking your time to do another helpful webinar. You're welcome. I'm using Cryptal Lapis to treat Lyme, Bartonella, and especially Babesia. I believe that you normally recommend taking 1 teaspoon 3 times a day. That seems like a high dose. Do you find that most of your patients can handle that high of a dose, or can most of them not handle it? Also, do you think Cryptal Lapis would be effective at all if the daily dose was about 20% of the amount that you recommend? Also, do you recommend patients start slow and work their way up to your recommended dose of 1 teaspoon 3 times per day, or is it better just start at your recommended dose? Okay, so that dose is a dose that I have found helpful in Babesia, and it's a dose that I know, for instance, that Horowitz, as in why can't I get better Horowitz, Dr. Horowitz out of the East Coast, that's a dose he uses in his Babesia treatments as well, too. Okay. I have to admit, as I've started using it as part of my Bartonella and my Lyme treatments, that I find I'm not having to go quite as high as that. But the dose I'm recommending is more, especially if you have Babesia involved. Okay. And, you could try and dose 20% less and see how you do. It's just that when Babesia is involved, I find the best response is at a teaspoon 3 times a day. Okay? All right. Good luck to you, Jake. All right, everyone. That's it. We're at 5:33 here. So I've had a good time being with you tonight. I look forward to seeing you again in 2 weeks. Keep an eye out on your email tomorrow morning. You'll get an email from me announcing that the recording is ready, the synopsis is ready, and you can go look at it, okay? Also, in that email, you have an opportunity to sign up for the series of webinars that we will do in October, and I hope to see you there. Tomorrow, when you get my email, help me. I want to reach people. I want to help a lot of people get better from Lyme. And as you can tell from a number of the comments here tonight, the recommendations I give do help. So that's good to see. And I get reports of that all the time. So if you know of anyone that might get some benefit from showing up at these webinars, pass it along, pass it on. Pass on my emails, okay? Let them know when the webinars are, and share with them the information from the recording as well, too. All right? I'd appreciate it if you'd help me do that. All right. Good night, everyone. I enjoyed being with you here tonight. I hope everyone has a lovely beginning of fall, and I hope it brings good things your way. All right. Good night.